and the types of fingerprints, poroscopy, types and the medico-legal importance of poroscopy, comparative techniques used for identification. We'll be also studying about the tattoo marks and the medico-legal importance of tattoo marks, cephalic index, medico-legal aspect of age, medico-legal aspect of hair, corpus delicti, age estimation by teeth by Gustafson's method. So this Gustafson's method is very important, not only in your theory, but as well as in your practicals. It can be asked as a viva voce question also. Klinefelter syndrome, estimation of stature from long bones, bar body, rule of Hayes, and also sex determination from skull and pelvic bone. So the last question, the 14th question, sex determination from skull and pelvic bone is also one of the very important topic that will be asked in your practicals. So you'll have to know the different various features in the skull and pelvis, and you should be able to say how these are different in the male as well as a female skull and pelvis. So most of these questions are short essay type of questions. So you need to write specifically. And in this session, we'll be doing the exact same thing. We'll be discussing about how you can answer these questions. Okay. Now coming to Auricle, why choose Auricle? Because Auricle is a platform where we have different things. We have recorded classes, we have live classes, we have practical sessions, exam module, as well as hard copy book set is also available. So all these features are available in a single platform, which will ease you in preparing for your exams. And that is why I would suggest you all to take up Auricle. Now coming to the recorded classes, so what does recorded classes have to offer to you? So and you can revisit all these topics whenever it is of need. And also whenever you have to revise and if you feel like you've forgotten something, you can revisit these lectures and watch all these videos.
Ma'am?
Yeah.
Actually, we can't see your screen, ma'am. We can see only your face, actually.
Yeah.
So that is the reason we have stopped the recording.
Okay, okay. We'll start. Now wait 1 second.
Yeah.
Now check. Hello?
Yes, ma'am. Now we can see the screen, ma'am. I guess
Okay.
we have to start from the starting.
Okay,
From
okay,
the
done.
slide.
Not an issue.
సంధ్య గారు
యా
మళ్ళీ స్టార్ట్ చేసుకోండి లైవ్
యా ఇప్పుడే స్టార్ట్ చేస్తాను
we can delete that one which we have recorded
Yeah.
previously.
Okay, okay. We'll start now. Hi everybody, welcome back to this class. In this class, we'll be discussing the various important questions from the chapter identification. So identification is an important chapter where you have so many shots, that is the 3 marker and 5 markers that are asked. And also there are a lot of things that can come in your practical exams. So we'll look into the important questions that we'll be discussing today. We'll be discussing about dactylography and the types of fingerprints. We'll also discuss about poroscopy, types and medical legal importance of poroscopy. We'll also see what are the comparative techniques that is used for identification, tattoo marks and medical legal significance, cephalic index, medical legal aspect of age, medical legal aspect of hair. So as you can see in all these questions, what is important? The medical legal importance of a question is very, very important. And more so, it is same for almost all the questions, okay? Because the base for all these is helping you in identification. So the points that you write for any of these should be in that regard, which will ultimately give the examiner the sense that you've understood how medical legally all these things are helping you to identify a person. Got it? Next, we'll be discussing about the corpus delicti. We'll discuss about the Gustafson's method of age estimation by teeth. Now, coming to the Gustafson's method. So, Gustafson's method is very, very important, not only in your theory, but also for your practical exams. So, there are 6 things under it which can be asked in your viva voce as well. We'll be discussing about Klinefelter syndrome. It will be discussed much more in depth in your physiology, pathology, as well as medicine. We'll be discussing about estimation of stature from the long bones, bar body, rule of Hayes, as well as sex determination from skull and pelvic bone. Coming to the last question, sex determination from skull and pelvic bone. This is very important because in your practical exams, your examiner is going to point at certain points in your pelvic bone and the skull and ask you to identify the point as well as to differentiate it from male and female skull. So before going to your exam, you need to be thorough with all these questions. Now, coming to Auricle, what does Auricle has to offer to a student? So Auricle is a platform where you get multiple things. Okay, so you have recorded classes, you have live classes, practical sessions, exam module, as well as hard copy books. It is also available. So this platform provides you with all these various resources that you can use for preparing for your prof exams as well as all the other exams that follow through. Now, coming to the recorded classes, what do you find in recorded classes? There is a flexible learning atmosphere. What do you mean by flexible learning atmosphere? Here, you can use all these recorded classes to watch it anytime, anywhere, and you can revisit these as many number of times that you want. If you feel like you have forgotten the concept, go back, rewatch the video. You have that flexibility with recorded classes. Also, all the expert educators here will guide you through and through. Not any topics, however small or big, is taken care of. And also it is going to be a convenient platform for revision. How convenient for revision? Because you can watch it any number of time anywhere. Okay, if you feel like you've forgotten something, just revisit the particular chapter, particular video and watch it. Coming to the live classes, so this live classes also is why classes, watching live classes comes very handy. The educators will tell you how you need to approach the subject, how you have to make study plans, how you have to develop your answer writing skill, and so many more. How you have to put images or flowcharts in your paper so that you have that extra edge over others in scoring extra marks. So these are going to be interactive sessions where you can ask doubt. You can there are MCQ polls also, viva voce also, so that your learning becomes more fun. Okay, and there is no monotonous learning. Coming to the express exam, here the syllabus of the subject covered in 20 hours. See, just imagine in less than 20 hours, you're finishing a subject. How cool is it, right? And here you'll also be getting extra input about how you have to fill in diagrams, flowcharts, and how effectively you need to write answer to get all those extra marks. So the expert educators here will be there with you through and through and be guiding you exactly with the same. Coming to the one-to-one doubt clearing sessions. So one-to-one doubt session is a centric approach that is taken. However small the question or however tiny it is given equal importance in order to make you understand, make you give that comprehensive understanding of the subject. There is personalized attention given to each student so that all the doubts are cleared and it is a safe learning environment. For example, if a student doesn't want to get up in the class and ask a doubt because he feels like he's judged by his fellow mates, that isn't there in the one-to-one doubt clearing sessions, because here personalized attention is given and you can use this in order to understand everything. Nobody is going to judge you through your preparation. Okay, now coming to the hard copy note set, what do hard copy notes set give you? It gives you in-depth coverage of the entire syllabus. There are a lot of images here, there are a lot of flowcharts, colorful, that you can easily retain all these. It is going to help you develop that picture skill memory. Okay, now coming to the Q bank. So the Q bank is designed in such a way that there are okay, so from beginner you go up to the expert level. So expert level is the highest level and this is customizable. So questions related to that so that you are studied. Okay, and these MCQs cover all the MCQs that will come in your prof exams, NEET PG as well as FMG, so that it is going to help you ace all these exams. Now coming to the practical sessions, so there is going to be hands-on experience to engage all the students in the interactive session that simulate real clinical scenarios. So by this, what do you understand? That is, there is usually a gap in your college when practicals is being taught for you. During the theory classes you have specific practical hours, but there is going to be 3 to 4 months of gap before you actually go and give your practicals. That gap is bridged here in Auricle. Just before going to your exams, if you come and watch these videos, you get that hands-on experience. It is going to exactly tell you what questions might be asked, what topics will be coming. There is expert guidance that is given to you. So all these will ultimately make you excel in your practical exams. Okay, now coming to the different subscription plans that are there. Number one, we have the foundation plan. We have advanced learning plan, complete learning plan, as well as ultimate MBBS plan. Coming to the foundation plan, we have pre-recorded classes here, live classes here, express exam module, practical sessions, as well as question bank. So all these 5 things will be available in the foundation plan. Coming to the advanced learning plan, we have the pre-recorded classes, live class, express exam module, practical and Q bank, and it is for a period of 6 months. Coming to the complete learning plan, apart from all that was mentioned before, you also have hard copy notes set and one-to-one doubt clearing session. And coming to the ultimate MBBS plan, as a name says, it's ultimate. No, so what do you understand by ultimate? So you are going to get all these for a period of 4 years. How cool? No, you're going to be covered through and through throughout your MBBS. Okay, so you can use the code Dr. Prashi Kaveri 20 for discount on your subscription, and I Auricle. Now, coming to the chapter per se, coming to the chapter of identification, we'll be discussing certain important questions. The number one is dactylography and the types of fingerprints. So what do you understand by dactylography? It is nothing but study of the fingerprint. It is a method of identification, and this dactylography also has so many other names like dactyloscopy as well as Henry Galton system of identification. So in the exam, if they ask you only Henry Galton system of identification, you have to write about dactylography because all these are one and the same. If you look at the image here, these are the different types of fingerprints. See, this one that is there in the circular format is a wall. And then you have another format, loop. So this is the one that is found in majority of the people. If you look at your fingerprint, like for example, mine, it is a loop. So it is looped towards the right side. It could be looped towards the right as well as left. Then we have arch, like a temple arch. No, it is going to be like this. And composite, which is a sum of all the 3. Everything together is called as composite. Now, what is the process of dactyloscopy? It is a process of taking impressions of the papillary ridges of the fingertips for the purpose of identification. So in this chapter of identification, whatever we're doing, there are different things, okay? There is retinal imaging, there is poroscopy, there is fingerprint, dactyloscopy, so many things, okay? So the purpose of everything is to identify a person. So this method of fingerprint identification or dactyloscopy is absolute. That is, it is 100% accurate because even identical twins will have different type of fingerprints, and there is very little scope for any error. What is the basics of dactyloscopy? Nothing but unique. That is, rich pattern in 2 fingers differs and can never be same. Even as I told you, even in twins, identical twins, it is going to be different. And once formed, these are going to be relatively permanent structures. The rich pattern is an individual never changes except for the size. That is, as a child grows up, the gap is going to become a little more, but the pattern is going to remain the same throughout his life. What are the types of fingerprints? As I showed you in the image, we have loops. Coming to wall, the surf fingerprint is wall. It's seen in around 25% of people. Coming to arch, how does arch look like? It is seen in 7% of people, and arch looks like this. Coming to composite, it is a sum of everything. So everything is going to be there in composite, and it is seen very rarely in only about 2 to 3% of people. There are around 10 to 12 points of fine comparison, and that can be accepted as proof of identity. Okay, so if you get 10 to 12 points, which is same in between the accused fingerprint and the fingerprint that was obtained from the crime of scene, around 20 to 12 points of identification of similarity, you can say that the fingerprint matches. Okay, so this pattern is not inherited. As I told you, it is going to be different. Even for twins, it is going to be different. Father, it is different. Son, it is different. Everybody's is different. Therefore, a paternity cannot be proved. What is paternity? Claiming that a particular child is a child of a certain person. It cannot be claimed because this is unique and it is not inherited. So, as I told you, it is different even in identical twins. Now, coming to poroscopy. So, of the fur of the hands, it has certain microscopic pores which are formed by the mouth of the ducts of subepidermal sweat glands. So, in a finger, you have certain ridges like this. Okay, so on these ridges, we have certain pores. see, these are the certain pores that are found. So what are these pores? These pores are nothing but the opening of the duct of certain glands. So there are certain glands and they have this duct and there is opening. So this opening that is there on the ridges of the finger, no, this opening that I'm pointing towards in the arrow is nothing but a pore. And you can study this, and the study is called as poroscopy. And these pores, like fingerprints, these pores are also going to be permanent and they do not change during the life. And when are these useful? Then we can tell, no, ma'am, we have fingerprint study, we have dactylography. Why should we study pores then? It is useful only when only fragments of the fingerprints are available, like complete was not available. You just have a piece of the fingerprint, and how will you do the entire fingerprint study? No, in such cases, poroscopy is going to help you. Got it? Okay. Now, coming to what are the different types? We have latent print. What do you understand by latent print? Latent, as a word suggests, what do you mean by latent? It is nothing but not visible, barely visible, or invisible is called as latent print. One print is latent print. Next, we have visible print. What is visible print? When fingers are stained with blood or ink. So when there is blood or ink on the finger, as you give your thumb, in certain documents, that is when it is clearly visible. It is called as a visible print. What is plastic print? It is made on the soft surface such as soap, cheese, etc. Because it is made on some other surface which is having a very soft architecture, it is called as a plastic print. Because if that is wiped off, it will go off. Okay, that is why it's called as a plastic print. Now, how do you develop this latent print? What are latent print? As we discussed, latent print are the print which are invisible. The invisible prints are latent print. So if they're invisible, you have to do something to see it. No. So what do you do? By dusting the area with colored powders, and its pattern is recorded by photography. So when you dust this area, the impression is created and you can photograph so that you have the impression photographed with you. Okay. And also you can use oblique lightning in order to examine. So when you eliminate it, you can see it clearly. Got it? Now, there is also one more technique which you can use in order to see this fingerprint. It is called as fingerprint. The light reflected from the fingerprint can be measured and converted to digital data, classified, codified, and stored. How cool, no? So when you have latent print, after it is computerized, that means you have the detail in your system. So it is going to become a permanent record. You can use it as evidence later. So what is the medical legal importance of poroscopy? Impressions left at scene of crime is used for recognition. Identification of persons suffering from loss of memory or those dead or unconscious after being involved in accident. So you can, number one, as the name of the chapter suggests, you can identify a person. Number two, whenever there is a road traffic accident or something, whenever if the fingerprint is there somewhere on the vehicle, for example, a steering or a bumper, you can identify the person. It is even helpful in recognizing decomposed body. So in decomposed body, when the facial features are not clear, and fingerprint can be used for recognition. Accidental exchange of newborn infant. Sometimes in hospital, what happens? A newborn infant could get exchanged, okay? And what we do as soon as, if you have, when you go to your OBG and when you go for your clinicals, you'll find that after a baby is born, usually a footprint is taken. Same logic applies here also. So why is footprint taken? Because in cases of accidental exchange of the newborn baby, by looking at the footprint, we can identify whose baby it is. And it is also useful to maintain the identity records. Okay, so these are the medical legal importance of what? Poroscopy. Now, coming to the third question, comparative use for verification. So there are various comparative techniques. Okay, so these comparative techniques include, number one, morphological comparison. What do you understand by morphological comparison? In general, what do you understand by morphology? That is the external features. How does a person look like externally? When you look at them, is called as morphology. It is analyzing physical characteristics such as shape, size, structure to differentiate species or objects. That is, you see something from outside, externally. By looking at the external features, you try to identify. That is called as morphological comparison. You also have genetic analysis. What is genetic analysis? Comparing DNA sequences to identify genetic relationships, often used in forensic investigation and species identification. That is, if you do a DNA sequencing, DNA, what do you understand by DNA? That is nothing but a core element in the body, no? And what is it famous for? It is very, very unique, okay? So each person can be identified by genetic analysis. So this is the second type that can be used for a comparative study. We also have chemical profiling. Substances to distinguish between different materials or organisms. So if you use any of the samples, like for example, if you use a blood to study something, you use a saliva to study something, do some chemical tests, you use certain organic matter from the person in order to do certain tests. So all these come under the chemical profiling of the person. Okay. Next, we have behavioral analysis. What is behavioral analysis? Observing and comparing behavior pattern to identify people or species commonly used in ethology and psychology. So you'll see the behavior of the person, like how he is behaving to himself or with people nearby. By looking at the behavior, if you try to compare, it comes under behavioral analysis. Okay. Coming to the statistical method. So it utilizes statistical models to compare the data sets, identify significant differences or similarities among groups. So the statistical method is a computerized method. Okay. So it is a very high profile type of comparative study, I would say, where you use the computer in order to compare similarities and differences between certain groups of people. It is used for advanced researches. Okay. So these are the 5 types of comparative techniques that can be used in order to identify people. And you can also compare different other things like the bone structure by the pelvic bone and the skull bone, by looking into the teeth, by looking at the stature of the person, or the by looking at the skull's cephalic index. So these are the other things that can be used in order to compare between two people. Next, what are the other types of comparison? There is something called as linguistic analysis, that is comparing the language patterns, syntax, and vocabulary to identify the authorship of language origins. So what do you understand by linguistic analysis? So there is an accent. No, every person has an accent. So how do we talk? We all have this Indian accent. Okay, if somebody is faking, then maybe they have some other accent, but generally all of us Indians have this Indian accent. Similarly, Europeans have a particular accent. If you go to north, the way they speak Hindi would be different than how people talk in the South India. No, so there is this touch of accent that comes with language, and this is also useful in identifying a person. Coming to image comparison, using digital tools to compare visual images for identification purposes, such as forensic imaging or species classification. So, okay, now coming to what are the different types of identification that we saw for comparative analysis. We have morphological comparison, genetic analysis, chemical profiling, behavioral analysis, statistical methods, linguistic analysis, and image comparison. So all these can be used to identify people. Okay. Now coming to the next question, tattoo marks and medical legal importance of tattoo marks. So what are tattoo marks? These are the designs which are imprinted in the skin by multiple small puncture wounds with needles or an electric vibrator dipped in coloring matter. So these are basically puncture wounds. Okay, there are small punctures happening, and it can be done with a needle. That was traditionally in the olden days, it would be done with the needle. But now there are vibrators which are dipped in the coloring solution, and the coloring matters, like for example, India ink can be used, cinnabar can be used, vermilion can be used, chromic acid can be used, indigo or Prussian blue. We can use any one of these coloring matter, and different colors are got because of it. Okay, and what happens, these dye go into the dermis. So we have the epidermis, and after epidermis we have the dermis. No, we have both the the papillary dermis and the reticular dermis. So this tattoo mark is going to the dermis. So if it was there somewhere superficially in the epidermis, it could have been washed off. But what happens is this tattoo goes into the dermis. So once it goes to the dermis, it becomes permanent. It is going to stay there. Okay, even in the decomposing body, we can see the tattoo marks. Okay, and if there is a lymph node near to the place where a person got tattoo, this lymph node would have got absorption from the all these coloring liquids, and the lymph node would also show a deposit of pigment. Okay, now how to erase a tattoo? The surgical method can be used in order to erase a tattoo. Complete excision, skin graft to remove the entire tattoo, and then use skin in order to graft it. Or carbon dioxide snow can be used. So whenever a carbon dioxide snow is used, it is going to bleach the skin in such a way that the tattoo gets erased. Electrolysis can be used, caustic substances can be used, and a laser beam can be used. So whenever there is caustic substances used, there is going to be charring of the skin. So when there is charring of the skin, the tattoo is going to be removed. Okay, so these are the various methods how we can remove tattoo. So laser beam is the most common method of removal of tattoo that is used in these days. What is the medical legal importance? It helps us to identify the person. Figures means perversion, travel history, war, occupation, gang members, illicit drug users, homosexual. So based on the type of tattoo that a person has, you can identify a lot of things. Okay, like for example, if he has a tattoo of, for example, let's say Om, what do you understand by it? Maybe the person is Hindu. Okay, or if he has a cross, what do you identify? That means he is a Christian. So based on the type of tattoo that a person has, you can get to know a lot of things. Or maybe if he has a tattoo of a beach, what does it indicate? He's a beach person. No? So basically, you get to know the lifestyle and the liking of a person. If he has certain indecent figures, it means he might be into perversion. Or if there are gang members, okay, they'll have similar. For example, if they might have a tattoo between the thumb and the index finger, and this is same for so many people who are in the gang. And just by looking into the tattoo, they are able to identify that they're of a particular gang. In certain movies, no, you would have seen that there are certain tattoos in the tongue, and when they show that tattoo, the people of the other people of the gang identify that they're also their people. So these are the importance of medical legal, importance of tattoo. Okay, coming to the next question, cephalic. What do you want cephalic? The maximum breadth of the skull. So the breadth comes in the numerator, that is the maximum breadth of the skull divided by maximum length of the skull. Okay, so this one, if you multiply it with 100, it gives you something called as cephalic index. Okay. So, based on cephalic index, based on the range of cephalic index, we have different types of skull. Number one is dolichocephalic. Dolichocephalic means long-headed skull. So, when you look at the person, the skull is going to be long, okay? The length of the skull is going to be more, it's going to be long. So, it's called as dolichocephalic. It is from 70 to 75. If the cephalic index is 70 to 75, it's dolichocephalic. That is pure Aryans, Aborigines, and Negroes. These come under dolichocephalic. Next, we have mesaticephalic. What is mesaticephalic? This is nothing but medium head. Okay, the center one is mesaticephalic, and mesaticephalic, like the cephalic index is from 75 to 80. So where did it start from? 70. So you have to add 5, 70 to 75, 75 to 80 is mesaticephalic. And the Europeans, Chinese come here. What about Indians? Even Indians come under mesaticephalic. Got it? Next, we have brachycephalic, which is short-headed, and that is from 80 to 85. That is the Mongolian race come under the brachycephalic. So if they ask you a question about cephalic index, just write the definition of cephalic index, write these 3 points, and write which range of cephalic index comes under these and the example. It is going to cover everything. Trust me, it's a very short answer. If you know up to the point, you can answer it. And all these can be asked separately as your MCQ questions also. Okay. Now, what is the medical legal importance of age? Number one, criminal responsibility. Any act done by a child less than 7 years is not an offense, because we think that child less than 7 years doesn't know what is right or wrong, and because it doesn't have the understanding capacity, we say that it is not an offense. If the child is from 7 to 12 years, maturity of understanding is judged. We ask certain set of questions to the child in order to understand how much the child is capable of understanding. And if we feel like he is able to understand the consequence of his crime, then he'll be punished. Otherwise, we'll consider him as a minor who doesn't understand the nature of the crime, and he will not be guilty. Coming to judicial punishment, the period of stay in the juvenile home should not extend beyond 18 years. That is, if the child who was less than 18 years is sent to the jail, once he is 18 years, he is able to come out of the jail. Okay. Rape. Sexual intercourse by the man with a girl under 18 years, even his own wife, even with a consent, is rape. That is, even if they are married. Remember this point, married plus consent, both the things. Okay, there are both the things, but the female is less than 18 years, then it is coming under rape. Why? Because the legal age of marriage in our country is, for girls, is above 18. Got it? Next, kidnapping. What do you understand by kidnapping? Taking away a person by illegal means is called as kidnapping. If the age of boys is under 16 years, the boy's age is less than 16 years and the girl's age is less than 18 years, it comes under kidnapping. Okay. Remember, it's not the same age. For girls, it's higher. Until 18 years, you say it as kidnapping. Employment. Child less than 14 years cannot be employed for any type of work because these are child, no, these are very tender, these are the growing people, no. So we do not want to admit the child to some kind of work. So less than 14 years, we do not employ. Attainment of majority on completion of 18 years, you can vote and you can select your own leaders. So you have the right to stand up for yourself. That is when you attain majority, 18 years. Child of any age can give evidence. Remember this. Marriage for a female, the age is 18 years, and for men, it is 21 years. So these are the various importance of age. Okay. Now, what is the importance of another age? Okay, 58. What is the importance of 58? In lot of government services in our country, so 58 is the age when the people retire. Okay, so this is the importance of age 58. Got it? Okay. What is the medical legal importance of hair? Medical legal importance. In the rape, pubic hair of the accused may be found on the victim and vice versa. So this is the number one importance. Okay. So whenever there is an act of sexual intercourse, the pubic hair of victim or the accused might be present on each other, and that helps us in identification. Stains on the hair indicate nature of assault. Example, mud stain in struggle. So what happens if the person was there in the open, somewhere in the ground or in the forest, and somebody tried to kill him? And if the person was pushed to the ground, if there is mud in the hair, it indicates that the person was dragged somewhere. There's a lot of struggle. Okay, so it tells you about the type of crime. Nature of weapon based on the injury to the hair and the hair bulb. Like, for example, if there is a clean cut to the hair and the hair bulb, you can say that there was an incision. But if the cut was not clean, then you can say it was laceration. So the type of injury, if the and plus, remember, if it is a firearm injury, if there is singeing of the hair, it indicates that it was a firearm injury. Therefore, hair helps you in the purpose of identification. Hair also helps you in sex and blood group determination. How? Because it has DNA in it. So using this DNA and the blood that is there near the hair follicles, all these will help you in identifying the person. So as I told you, if there is singeing of the hair, it means that there was a firearm injury. There was some burn injury. If there is a heavy metal poisoning, like for example arsenic, it can be detected in the hair. So this is a point that you have to remember. Remember, for a metal, that is arsenic. Which is the metal? Arsenic. By looking at the hair, because in the hair you can detect arsenic, you can identify the poisoning. Okay. Now coming to corpus delicti. What do you understand by corpus delicti? Corpus delicti means the body of offense or the essence of crime. So corpus delicti is something which is the essence of the crime. What do you understand by essence of a crime? That means it is saying for sure that crime has occurred. That is meant by corpus delicti. Example, in homicidal death, body of the victim and other facts which are conclusive of the death and foul play, for example, bullet, knife, etc., come under corpus delicti. That is, anything that is found in the area of the crime which suggests that the crime has happened comes under corpus delicti. And it could be anything. Okay, it could be a bullet, it could be knife, it could be some cloth fragment, it could be any other, it could be a gun, it could be blood, anything which suggests that a crime happened is corpus delicti. What is the main part of corpus delicti? It helps in establishing the identity of the dead body and infliction of the violence by person charged with the crime and none other. So basically it says that it is a proof saying that there is a crime that has happened. So what could be the things that will aid you in identifying it? As we saw, bullet, knife, cloth, hair fragments, blood, seminal discharge, anything, or a slipper that is left there, a gun that is left there, a hammer, anything that suggests you a crime has happened is corpus delicti. And what is the use of corpus delicti? It is nothing but it is the essence of a crime. Okay, it says you for sure that crime has happened. Okay, coming to the next question, that is age estimation of the teeth by since third. I told you not only for your theory, it is also in for your practical exam as well. Okay, and also there are so many points which can be asked even in your Viva WOSI. And these are the 6 points that are there in Gustafson's method that you have to know. And can we use Gustafson's method for any age group? No, you cannot use. It can be used for age estimation of adults who are over 21 years. So for you to use Gustafson's method, the person should be above 21 years and look at the various changes that are there in their teeth, and then you identify what has happened to the person. Okay. Number 1 change is called as attrition. So what is attrition? It is nothing but the wear and tear due to mastication upper surface of the tooth is destroyed gradually. So I'll show this to you. Okay, usually whenever a permanent teeth is erupting, you would have seen, no, there are certain serrations on top of your teeth like this. So what are these serrations called as? There is a very interesting name. Okay, so these are called as mamelons. So these things, as we age and as we chew a lot of times, will get converted into a firm, very smooth surface from the serrated surface. So this process is called as attrition. Next, we have periodontosis. What is periodontosis? Regression of the gum and the periodontal tissue surrounding the teeth with advanced age. That is, if you have a teeth here, you also have gum that is surrounding it. And there is going to be a regression of this gum that is surrounding it. It is the surrounding to teeth. No, surrounding teeth is gum. So the changes there is called as periodontosis. Next, we have secondary dentine. That is develops from the walls within the pulp cavity and reduces the size of the cavity. Later, completely fills the cavity. So here what happens? So you have this pulp cavity. No, you have the teeth, and you have, this is the teeth. Size. So this process where the pulp cavity is decreasing is called second dentine. Next, we have cementum upton. Secondary cementum slowly throughout the life forms incremental lines which are seen as cross striations on the teeth. So how do these look like? So if this is the teeth, you have certain cross striations on the teeth, and these are called as incremental lines. Got it? So what are the other change? We have root resorption. So how does root resorption look like? It involves both the cementum and dentine, and it shows characteristic groups. Okay, so this root resorption is going to start from the apex and extend upwards. So it is going to look like this. So if it's a lower jaw, there are certain marks like this root resorption which are going to go upwards. Okay, so down it's going to start and go up, whereas in the upper jaw, up to down. This is how a resorption looks like. Transparency of the root. Okay. So this transparency of the root is going to start after 38. After the person is 30 years, it's going to become transparent. Okay. And this one is the most reliable sign. This can be asked as a Viva VOC. Among the 6 things that are there in your Gustafson's method, which is the most important sign to say that the person is above 30 years? What is it? It is transparency of the root. So if you can see the image here, the number 1 is attrition. As I told you, because of chewing, there is going to be softening of the corners. It is called as attrition. Secondary dentin deposition, because of which the pulp cavity size is going to reduce. Root translucency, that is the entire teeth root, it is going to become transparent in color. It is going to start from the apex and it is going to move upwards. Root resorption, that is there. And also cementum apposition, that is deposition of a cementum, because of which incremental lines are formed. So these are the changes that are seen in teeth, and it is proven by Gustafson's method. Next, we have filter syndrome, where the chromosome is XXY. Set of X chromosome. Got it? So now coming to the different points for it, it has a genetic basis. Klinefelter syndrome is caused by non-disjunction during meiosis, leading to presence of 1 or more X chromosomes. What do you understand by non-disjuncture? We know mitosis and meiosis, no? So what is mitosis? It is a reductional division, so where you have equal number of chromosomes. For example, if it was 46 X and X, so both are going to have 46 X and X, 46 X and X. Coming to, this is mitosis. Whereas in meiosis, what happens? It is going to become half. So the half, if it was, for example, 46XY, one is going to get 23X, another one is going to be 23Y. This process of reduction is called as meiosis. Got it? So whenever this meiosis happens, there should be proper separation of X and Y chromosome. But if it doesn't happen, this X also goes off. Okay, then it is called as, because non-disjuncture, that is, it is not separating well, then it is called as, it is one of the feature which acts as a genetic base for look at them, they're going to be very tall men. Okay, they're going to look like this Australian, so very tall. So these people are going to be very tall. They have reduced muscle tone and have gynecomastia. So what is gynecomastia? Like females, there is going to be breast enlargement that are seen in this men. These also have certain hormonal imbalances. That is, they have low levels of testosterone. Because they have low testosterone, that is one of the reasons why you have gynecomastia in these people. And because they have low testosterone is important, no, for development of secondary sexual characteristics. It is also important for puberty. So all these is delayed. So there is infertility, delayed puberty, and the secondary sexual characteristics, for example, mustache and the axillary hair. All these also develops very later. The coarse voice, no, all these also takes time to occur. Coming to the cognitive and learning challenges, many affected individuals experience learning disabilities and may have difficulties in language and execution functioning. So what do you understand by all these? To understand that, the man is going to have a very big physique, okay? He's going to be very tall person, and he is not going to be very mentally sharp. He might have difficulties in learning and executive function. Plus, he'll have gynecomastia and all the other male related problems like infertility, delayed puberty is also going to be there in a person with Klinefelter syndrome. And it is exclusively seen only in males. Testing. And if you the person has XY, it indicates that the person has Klinefelter syndrome. How do you manage a case of Klinefelters? Treatment options include hormone replacement therapy. So what hormone do you give here? You give the person with testosterone, because the testosterone levels in these people is low. You help them with the fertility assistance. You give them educational support to address the learning difficulties. Early intervention can improve outcomes significantly. Okay. So supportive treatment is very important in all these people, okay? Because these genetic problem, no, they might feel like the person is just tall enough, he's just growing well, but later once, because puberty has not started, there's going to be delay in puberty, like until 16, 18, there's no puberty, then they seek help, and then they realize that the person has a lot of problems. So if the person would have got a genetic testing done early, and if they'd identify that the person has all these problems right from this young age, he could have given that extra attention in terms of academics or anything needed, that psychological support in order for him to live life. The next question is about estimated stature from the long bones. So what do you understand by stature? Stature is nothing but height of the person, or the body dimension, the vertical length of the person. This vertical thing, no, this is called as stature. Now, coming to the stature is an important criteria for identification of person. And starting from the intrauterine life, stature increases up to 20s. After 20s, there is halt in the growth of the person. There is stop in the growth. No? So until then, the stature, the vertical height is going to increase. After 20 years, though not much significance, it slightly reduces further after we age. So you can see, somebody who's very tall also, after they reach their 70s or 80s, they just bend little, they stoop over, therefore their stature might decrease. And the stature varies in different times of the day by 1 or half to 2 centimeters. That is, in the early morning, it is going to be more. Your height is going to be more. Why your height is going to be more in the early morning? Because of the relaxation of the intervertebral disc. You're going to be more free. But as you do a lot of work, as day progresses by, there is going to be a lot of pressure there because of gravity. Your stature, you might look around 1.5 to 2 centimeter lesser than how it was in the morning. Okay. Now, let us see the examples of determination of stature. How do we determine the stature? The number one example, length from the tip of the middle finger to the tip of the opposite middle finger fully extended. That is, you have to ask the person to stand straight, okay? So after the person stands straight, you are going to ask, see, now this is the person who is standing straight. You're going to ask the person to stretch his arms. How much does he have to stretch his arms? He has to stretch his arms fully, okay, like this. He's going to stretch his arms horizontal to the ground. So after he stretches this, you're going to take a tape and measure from the middle finger of one hand to the middle finger of the another arm, which gives you a rough estimate of the stature. They say that it is almost equal to the vertical height. Cool, no? So today, after this class, take your measuring tapes and measure it, okay? Twice the length of one with 30 centimeter added. So this is also going to give you another estimation of the stature. The height of head measured by the vertical distance from the top of the head to the tip of the chin. So how much? This one, from the top of the head to the tip of the chin. This one is 1/7 the total height. That is whatever distance you get from this. Imagine it is 30. So into 7, if you do, so this is a very tall person, then it is going to be 210. So this is going to be the height of the person. They say that the distance between the chin and the head, this entire distance into 7 is nothing but going to give you your stature. Got it? Now, bar body. What do you understand by bar body? A bar body is a condensed chromosome found in the female mammals. Here are 5 points about it. So these bar bodies found only in the females, okay, because they are the ones who have X. No, in this 2X, one of this which is inactivated is nothing but the bar body, and it is found near the leukocytes, and usually near the nuclear membrane of the leukocyte. You have a small condensed body which is called as bar body. This that I'm pointing in the arrow is a bar body. The bar body ensures that females who have 2X chromosomes do not express double the dosage of X-linked genes compared to males who have 1X chromosome. So this is the essence. This is something that most of the textbooks do not mention, okay? So you might ask, ma'am, why something has to be inactivated? Why there could have been no 2 normal X chromosome? Why? Because so males usually have only 1X chromosome. They're XY, no? So they have only 1, whereas females have 2XX, no? So there are certain diseases which are transmitted by X chromosome. Imagine if both the X and female had expressed, then female would have double the chance of getting the disease compared to men. That is why our body coolly is going to inactivate one of the X. Now, how it formed? The inactivation process occurs early in the embryonic development, randomly selecting one of the 2X chromosomes to become a bar body. So one gets inactivated or silenced, which is called as bar body. So how do you get the number of bar body? It is nothing but X minus 1. It is a formula to get the bar body. So female has 2X, no? Equal to 1. Female has 1 bar body. If it is male, male has how? So 1 minus 1 is equal to 0, which indicates male has 0X chromosome. Got it? Now, what is the use of bar body? It helps in identification. Bar bodies can be identified in the female cells by staining techniques appearing as a dense structure in the nucleus. So this structure that you can see here, no, the densely stained one, this is nothing but bar body. Genetic expression. While most genes on the bar body are silenced, some escape inactivation and can still be expressed. So in certain people, there's an expression. It may not be silenced and it can be seen. Clinical relevance. The presence of bar body can be used in the genetic diagnosis, such as determination of sex chromosomal abnormalities. So if it's a Klinefelter syndrome who has XXY extra chromosome, here, how much is the bar body? 2 minus 1 is equal to 1. No, but males usually do not have. This is where it helps us in identifying a genetic abnormality. Got it? Now, what is the rule of Hayes? So, rule of Hayes, that is during the first 5 months of pregnancy, rule of Hayes is basically useful in order to see the length of the child. Okay, so how do you do it? In the first 5 months of pregnancy, if you take the square root of the length, that gives the age of the fetus. For example, if the length of the child is 9 months, if the length of the child is 9 centimeters, the square root is nothing but 3. So the age of the child is going to be 3 months. You can follow this rule of Hayes up to when the child is 5 months old. There is something called as Hayes' modification of Morrison's law that can be used after 5 months. That is in the last 5 months. After 5 months, if the child is more than 5 months old, you use this Morrison's law. Here, what do you do? Length of the child, for example, if the length of the child is going to be 25 centimeter, if you divide it by 5, how much is the month? It's a 5 5s are 25. So 5 month old. If the length of the child was 30 divided by 5, it says it is 6 months. So use Morrison's law after the child is 5 months. Okay. So the initial one, till 5 months, you took the square root of the length. After 5 months, you divided the length by 5. Got it? Now, coming to the last question, it is sex determination from the skull and the pelvic bone. Now, coming to the sex determination from the skull, initially you have to look at most of the features in the skull are more prominent in male skull, okay? Like the size is going to be big in male, whereas Female skulls are smaller. The architecture is going to be rugged in male, whereas female is going to be smooth. And coming to the ridges, like the temporal ridge, where is the temporal ridge? Here you have the temporal ridge. It is more prominent in male, whereas less prominent in female. Supraorbital margin. So this is a supraorbital margin, which is round in case of male, whereas sharper, it is angulated like this in case of female. Zygomatic bone is more pronounced in male, whereas less pronounced in female. Coming to the mandible, this is the mandible. It is going to be squared in male, whereas rounded in female. Coming to the gonion, is going to be flared in male, whereas less flared in female. Teeth is going to be larger in male, smaller in female. Mastoid, where is mastoid? Mastoid is here. No, it is going to be medium to large in male, whereas small or medium in female. Coming to the nasal aperture, it is going to be high, thin, sharp margins, whereas in female, it's going to be wider and rounder. Mandible gonial angle. What is a mandible gonial angle? This is the mandible gonial angle. It is going to be less obtuse, whereas in female, it is going to be more obtuse. Got it? Okay. Now, coming to the sex determination by the help of pelvis. So how do you differentiate sex by using pelvis? So you have to look at certain features, okay? Generally, in the male, the pelvis is going to be more rugged. And because it is going to be rugged, because the muscles are very, bigger muscles are going to be attached. In female, it's going to be smoother. Coming to the ilium bone, it tends to be vertical in case of male, whereas in female, it's diverted laterally. It's going to be diverted laterally to give that extra space in the pelvis. Greater sciatic notch is small in male, whereas large in case of female. The composite arc is the edge of the articular surface, and the greater sciatic notch, it is going to be aligned in case of male, whereas it is going to be staggered in case of female. The articular surface is going to be large and flat, whereas in female, it's going to be small and elevated. The preauricular sulcus is not going to be seen in male, whereas it's going to be seen in female, especially in those who are multipara, who has given birth to a lot of kids, no? This preauricular sulcus is going to be seen in them. Obturator foramen is large in male, whereas small and triangular in female. Acetabular is large and laterally directed in male, whereas in female, the acetabulum, that is the attachment of the femoral head, takes place. So it's going to be directed anterolaterally. Istiopubic ramus is slightly everted in male, whereas strongly everted in female. Vertical arc is absent in male, whereas present in female. Subpubic angle. What is subpubic angle? That is the angle which is done below the pubic bone. No, it is going to be V-shaped in case of male, whereas U-shaped in case of female. Subpubic concavity is going to be, absent in case of male, whereas it is going to be present in case of female. Length of pubic symphysis is going to be very short in case of male, but in female, it's going to be long. And these are the very important features of differentiation that you have to know, especially for practicals. You have to know where exactly these are found and how is it different from a male and female skull. Now, after all these questions, I hope you have understood everything. Now, we will look into certain MCQs in order to see how much you have understood, okay, after studying. Now, coming to the MCQs, let us look into the MCQs, okay? Coming to the first question, what is dactylography primarily used for? What is the answer? We saw, no? What is dactylography? That was the first question. It is used for fingerprint analysis. Got it? Okay. Coming to the second question. Which of the following patterns is not commonly found in fingerprint? So what are the four things that were there in fingerprint? As we saw, we had loops, we had whorl, we had arch, we had composite. So in the options, let us see what are the options. We have loop, whorl, arch, triangle. Did we see triangle in fingerprint? No. So triangle is the answer here. Which of the following statements about tattoo marks as identification is true? Coming to tattoo marks, let us see the options that are given. Tattoos are not unique and can be easily replicated. Aren't they unique? They're unique. Let's see the next option. Tattoos can help establish a person's identity but are not reliable. Aren't they reliable? If they were not reliable, we wouldn't have used it, no? Coming to the fourth option. Tattoos are only used in criminal investigation. No, tattoos can be used even for civil purposes. Coming to the third option. Tattoos are permanent and can provide distinctive information about an individual. This is a correct answer. And this is a point that is in essence for using it as identification tool. Coming to the fourth question. What does cephalic index measure? Coming to the options, the height of the individual, the ratio of the width of the head to its length, the volume of brain matter, the density of bone structure. We saw, no, cephalic index. What is it used for? It is used for the measuring the ratio of width to the head in order to find out which race a person belongs to. So there were three types. We had long-headed, dolichocephalic, mesetocephalic, and brachycephalic. So the answer, right answer is option number B. A cephalic index of less than 75 typically indicates what head shape? Less than 75. Where did it start from? It started from 70. So less than 75 means 70 to 75. Which is 70 to 75? The initial one, long-headed people, they are dolichocephalic. If they're between 75 to 80, then it is mesetocephalic, medium-headed, or the mesocephalic. If it is 80 to 85, it is brachycephalic or short-headed. Where do Indians fall? They fall in the mesocephalic. Okay, let's look into some more questions. So coming to the other questions that are there. So we have okay, so these were the MCQs that we discussed today, and I hope you understood the topic very well. That's all. Thank you.